Most people have no idea, but the way you sleep tonight could quietly affect your stroke risk while you rest. One common sleeping position puts pressure on your blood flow, and after 60, that matters more than it did in your 30s or 40s. In the next few minutes, I'll walk you through the position doctors often flag and how to adjust it before it becomes a problem. If you sleep on your right side, stay with me, this applies to you directly. That position you're in most nights, the one that feels comfortable, might be quietly restricting blood flow to your heart. And here's what concerns me as a physician. A large share of strokes happen overnight, between midnight and 6 a.m., not during the day, not during stress, but while you're asleep. I'm Dr. John Paul. Over the next several minutes, I'll walk you through 5 sleep positions ranked from mildly concerning to genuinely risky, and then give you 2 positions that can help protect your brain and heart tonight. If you're over 60, this isn't just interesting trivia. It's worth actually acting on. Before we start, think about which one describes you: back sleeper, side sleeper, or stomach sleeper. Keep that in mind as we go through the list, because I'll tell you exactly where your habit falls. Position 5. Sleeping completely flat, no elevation. This feels natural, your spine is straight, and plenty of people swear by it. But here's what your body does when you lie completely horizontal for hours, especially after 60. Blood pools toward your head. Gravity isn't helping you anymore. In your 20s and 30s, your blood vessels are flexible enough to handle this easily. After 60, those vessels tend to stiffen, and the small arteries in the brain become more fragile. When blood pools in your head for 7 or 8 hours straight, pressure can build inside the skull. That pounding headache some people get at 3 a.m. isn't random. It can reflect that buildup of pressure, with blood that isn't draining as efficiently as it should. Research published in the Journal of Clinical Sleep Medicine has looked at this exact issue and found that even a modest elevation of the head around 15 degrees meaningfully reduces this pressure and improves blood flow back toward the heart. Here's a pattern worth noticing. Someone wakes up, sits up quickly, and feels lightheaded. It gets written off as just getting older. Often, that's actually a sign that blood flow dynamics during sleep aren't working the way they should, and it's worth paying attention to. Position 4. Right side sleeping with heart issues or high blood pressure. This sounds oddly specific, but the anatomy explains why. Your heart sits slightly left of center in your chest. When you lie on your right side, one of the body's largest veins, the inferior vena cava, which returns blood from your lower body back to the heart, can get compressed. Even mild compression means your heart works a little harder to pull that blood back. For a healthy person in their 30s, this barely registers. But if you're over 60 with borderline heart function or high blood pressure, your heart may already be working overtime. Add several hours of extra workload every single night, and it adds up. Cardiologists have noticed that patients with heart failure often instinctively avoid sleeping on their right side. It simply feels uncomfortable to them, which may be the body signaling something. Research in the European Journal of Heart Failure found that left-side sleeping was associated with more stable blood flow and less overnight strain on the heart in this population. Here's the concerning part. Someone can have well-managed blood pressure on medication, sleep on their right side every night for years, and never notice a dramatic symptom, while their heart quietly compensates night after night. That kind of cumulative strain doesn't always show up on a daytime blood pressure reading. Position 3. Stacking 2, 3 or 4 pillows. People do this to help with breathing, acid reflux, or sinus congestion, and some elevation genuinely does help. But excessive elevation bends the neck forward, sometimes dramatically. Running along both sides of the cervical spine are the vertebral arteries, which supply blood to the brainstem and cerebellum, the areas responsible for balance, coordination, and consciousness. When the head is pushed too far forward for hours, these arteries can be compressed, gradually reducing oxygen delivery to those regions. Waking up with a stiff neck and a dull ache at the base of the skull isn't always just muscle tension, it can reflect restricted blood flow. Research in the Journal of Manipulative and Physiological Therapeutics examined how extreme neck flexion affects vertebral artery blood flow and found measurable reductions. That research wasn't about sleep specifically, but the underlying principle that prolonged neck flexion affects circulation applies just as well to 8 hours in bed. A common pattern: someone wakes up daily with neck pain and a headache, assumes it's stress or age, then switches to a single, properly contoured pillow, and the symptoms improve within a week or two. Position 2. A tightly curled fetal position. This is one of the most common postures for older adults. It feels protective and instinctive, but physiologically, it creates two issues. First, your lungs can't fully expand. With knees pulled to the chest and chin tucked down, the rib cage compresses, and every breath becomes shallower than it should be. That tight, can't quite take a deep breath feeling on waking can reflect hours of restricted lung capacity. Even a modest drop in oxygen intake lowers blood oxygen saturation, which matters more if you already have cardiovascular issues or early lung concerns. Second, the neck and upper back stay under constant tension, keeping muscles contracted and putting light pressure on small blood vessels near the cervical spine and skull base, which can reduce blood flow to the brain. Research in respiratory physiology has shown that positions involving significant spinal flexion reduce tidal volume, the amount of air inhaled per breath, over a full night, which adds up to hundreds of shallower breaths. Someone might wake up foggy, with a dull headache or mild dizziness, and chalk it up to a bad night's sleep, when the underlying issue may be hours of reduced oxygen. Position 1. Going to bed soon after a large meal or alcohol. This is the riskiest combination on the list, and it's worth taking seriously. When you eat a large meal, your body redirects blood toward digestion. Completely normal, but it means less blood is available for the brain, heart, and other organs in the meantime. In younger adults, the body compensates easily. In older adults with narrower arteries, this redirection can contribute to dizziness or lightheadedness during sleep. Add alcohol, and blood vessels dilate, dropping blood pressure. For younger, more flexible vessels, this just feels relaxing. But for older adults with stiffer arteries or plaque buildup, this sudden drop can trigger a compensatory swing. Blood pressure spikes, then drops again. These fluctuations put extra stress on vessel walls. Research in the American Journal of Hypertension found that even moderate alcohol close to bedtime disrupted the normal overnight blood pressure dip. When that natural dip is disrupted, cardiovascular strain during sleep increases. Picture this: dinner at 8 p.m., a glass or two of wine, bed by 10. At 2 a.m., waking with a racing heart and a headache, dismissed as just a bad dream. Over time, these episodes can accumulate. If you take away one change from this video, make it this one. Finish dinner 3 hours before bed. If you drink alcohol, stop 4 to 5 hours before sleep. A short 15-minute walk after dinner helps too. Small, free, and genuinely effective. The two positions to use instead. Left side sleeping, because your heart sits slightly left of center. Sleeping on your left side lets gravity assist blood flow instead of working against it. Your heart works a little less, circulation improves, and the brain gets steadier oxygen delivery. There's also a longer-term benefit worth knowing about. About a decade ago, researchers identified something called the glymphatic system, essentially the brain's overnight waste clearance system. While you sleep, it flushes out metabolic waste, including proteins associated with Alzheimer's disease. Research published in the Journal of Neuroscience found that this system works most efficiently during side sleeping, particularly on the left. Every day, the brain accumulates proteins like amyloid beta and tau. In healthy brains, the glymphatic system clears much of this during sleep. When clearance is limited night after night, over years, that buildup can be more pronounced. Left side sleeping isn't just about tonight's stroke risk. It may also support long-term brain health. There's a bonus for anyone dealing with acid reflux, too. The anatomy of the stomach and esophagus means left-side sleeping tends to keep stomach acid down, reducing that burning sensation on waking. If you've slept on your right side or back for decades, this takes some adjustment. A body pillow, hugged in front of you, helps keep you positioned on your left side and supports your spine. Add a smaller pillow between your knees if you have joint pain. And if you roll over during the night, that's normal. The goal isn't perfection, it's spending more of the night in a better position than a harmful one. Back sleeping with gentle elevation. For some people, this works even better. Not flat, and not sitting fully upright, a gradual incline, raising the upper body 15 to 30 degrees, using a wedge pillow or an adjustable bed. 30 degrees, using a wedge pillow or an adjustable bed. This helps for 3 reasons. First, blood returns to the heart more efficiently from the lower body, which is especially useful if you deal with poor circulation, swollen ankles, or varicose veins. Second, pressure inside the skull decreases, which may reduce the risk of small vessel strain over time, the kind of subtle, cumulative changes linked to vascular-related cognitive decline. Third, breathing tends to improve, since the airway stays more open, helpful for mild sleep apnea, congestion, or snoring. One detail people often miss: pair upper body elevation with a small pillow under the knees to maintain the spine's natural curve and ease pressure on the lower back. NASA has studied this general, neutral body posture for astronauts since it distributes pressure evenly and reduces strain on joints and vessels. This isn't a universal fix, though. If you have significant sleep apnea, back sleeping even elevated may not be ideal, since the airway can still collapse. Left side sleeping tends to be better in that case. If you have heart failure, left side sleeping is usually preferable. The point isn't to follow one rule blindly, it's to understand why each position works and choose what fits your own situation. Your bedroom environment matters too. Even the right position won't help much if the environment works against it. Temperature. Aim for a room between 64 and 68 SFE. A cooler room helps your core temperature drop, which supports deeper sleep and a healthier overnight blood pressure dip. A room that's too warm keeps you in lighter sleep stages and your heart rate slightly elevated. Light. Try to reduce screens and bright overhead light in the hour before bed. Blue light suppresses melatonin and can delay the deeper sleep stages when the brain does its waste-clearing work. If you need a device in the evening, blue light blocking glasses or night mode help, or better yet, a physical book. Neck support. A contoured pillow that supports the neck's natural curve rather than forcing an unnatural angle. Protects blood flow through the vertebral arteries we discussed earlier. Noise. Even sounds that don't fully wake you can pull you out of deep sleep, briefly raising heart rate and stress hormones without your awareness. A white noise machine or earplugs can help mask irregular household or street noise. Tracking your nighttime health. If you want to go a step further, there are simple tools that can help you understand what's happening while you sleep. An overnight pulse oximeter, a small clip-on finger device, tracks oxygen levels through the night. Oxygen repeatedly dropping below 92% is worth flagging to your doctor, since it can point to sleep apnea, circulation issues, or respiratory concerns. Heart rate variability tracking, available on many smartwatches and sleep rings, reflects how well your nervous system is functioning overnight. Consistently low HRV can be an early sign of stress, inflammation, or poor recovery during sleep. A simple sleep journal, jotting down headaches, dizziness, numbness, or brain fog each morning, can reveal patterns that a single doctor's visit might miss. One important note: these tools are for awareness, not diagnosis. If you notice concerning patterns or persistent symptoms, bring that information to a healthcare provider rather than trying to interpret it alone. Why this rarely comes up at the doctor's office. Sleep position doesn't fit neatly into a standard appointment. There's no blood test or scan for it. In a short visit, Your doctor is usually focused on labs, medications, and acute symptoms. Sleep posture just isn't on that checklist. But the research is clear that sleep position can quietly affect blood flow, oxygen delivery, pressure inside the skull, and the brain's ability to clear waste proteins overnight, not through dramatic events, but through small effects that build up over months and years. For anyone over 60, especially those managing blood pressure or cardiovascular conditions, these nightly habits are worth paying attention to. The encouraging part: none of this requires a prescription or an expensive treatment. It requires awareness and one or two targeted adjustments, shifting toward left-side sleeping, elevating the head slightly, finishing dinner earlier, or switching to a single supportive pillow. Any one of these can meaningfully support how your cardiovascular system functions overnight. What to do tonight? Pick one adjustment from everything we've covered. Shift toward left-side sleeping, using a body pillow for support. Try back sleeping with a 15-30-degree incline and a pillow under the knees. Finish dinner 3 hours before bed and alcohol 4 to 5 hours before. Switch from a pillow stack to one properly contoured pillow. Cool your room to 64-68 FF and dim screens an hour before bed. Give whichever change you pick about a week and pay attention to how you feel each morning. Fewer headaches, steadier energy, a clearer head. Your body will tell you whether it's working. A quick note: this video is for general education, not personal medical advice or diagnosis. If you have existing heart, lung, or sleep conditions, or you notice new or worsening symptoms like chest pain, sudden weakness, difficulty speaking, or severe headaches, contact your doctor or emergency services rather than relying on a sleep position change alone. I'm Dr. John Paul. Sleep well and take care of that heart and brain. They're doing a lot of work while you rest.